Hey guys, Dr. Sean here. We're going to go back into our mailbag segment today. We were asked a question about Parkinson's disease and what do you do for it? You see Muhammad Ali had it. You see Michael J. Fox. He's a real, known celebrity that has it. And when it gets out there, people are more aware of it. But it's an interesting thing because there's so many factors involved with neurologic disorders, whether it's Lou Gehrig's, some type of dementia, an autism. These are all kind of that same umbrella of neuro disorders. So what we know about Parkinson's, there are neurons in your brain that when Parkinson's sets in, when the disease state sets in, they tend to die. And as they die off, now the brain function starts to slow. And some of these neurons produce a chemical known as dopamine. And this dopamine is what allows you really to have motor control, to be able to move your fingers and your toes and have confidence in that. And so what you see happening is that dopamine production starts to slow. As the cells die off, you don't produce as much. Well, now you lose motor control. And there's other tells that you'll see with it. You'll see things such as, gait is a big one. You'll see that the gait starts to be stooped forward and slowed. You'll see a tremor because they can't control hand posture any longer. You may notice facial changes sometimes in Parkinson's, or the inability to control simple basic things like blinking and smiling. All of these things can be involved. So when you look at it from that standpoint, what do you do with a patient that has this? Medically we know, okay, what do they have? They don't know the cause, which makes it very tricky to treat if you don't understand the cause of it. So they're limited in, well, this is what it does. This is how it progresses. So they try to slow that down. They'll use different medications that are designed to either increase dopamine in the system or dopamine-like substances into the system, or they'll use medications that are designed to stop the body from using dopamine elsewhere. Now, there's some tells here that we have. We know that dopamine is used in other places in the brain. The olfactory bulb, so your sense of smell uses it quite a bit for that purpose. And we noticed in Parkinson's patients that they tend to lose their sense of smell before we see motor issues show up. You'll also see it sometimes in the brainstem and things, and you'll see it in areas of the brain where that controls sleep and rest. And we notice in Parkinson's patients that they tend to start getting insomnia and sleeping disorders before they get the motor control issues. So we look at this and say, okay, there's tells. There's little tells that something's coming on the horizon. Now, there are no medical tests for diagnosing Parkinson's. There's no CAT scan, MRI, blood work, anything of that nature. Most of it is done today after you assume it might be there by implementing one of these drugs. You put the drug in and see if the symptoms that you have get better. If they do, they pretty much know, okay, then it's a Parkinson's thing, because it's really the only condition that responds to those type of drugs. Now, that being said and done, how do you go at it from a more natural, holistic, conservative approach? What do you do for something that's progressive? It doesn't ever go away, and it just keeps taking more and more and more. I think of it like, cartoons, the old Warner Brother cartoons. They light that little fuse on the ground, and it's just, you just watch it and burn along, okay? How do you slow down how fast it burns? Now, in the future, we're going to talk about care and levels of care and what you do for people. Acute care is easy, right? There's nothing to it. Things that have been there for a little while, no big deal. But there's degeneration cycles that the body goes through. And the further down the cycle you get, the more detrimental it is. And now the care has to be more long-term. So when you're dealing with someone with a Parkinson's condition or any neurologic disorder, the focus becomes try to find a cause. So let's go through a few things that we know are involved and little tells the body will give you. Stanford University did a research project years ago, and they found that people who have foot disorders, chronic, long-term, develop more Parkinson's, significantly more than people that don't. So you think to yourself, why would a foot problem cause... Oh, I talked about that brainstem earlier, right? And so if my gait is off, if I have a wobble to my gait and my body's sitting there going, oh, I don't want to do that, and it goes to fight it, now you create a pinch and an irritation and a rub to the upper part of the brainstem. So there's some kind of little link there. We're not sure what, but there's a link. And you say, okay, if there's a mechanical link to this, what else is there? We know in patients who suffer from Parkinson's disorders that a lot of times there's chemical involvement. Paints, sprays, insecticides, herbicides, any kind of neurologic type inhibiting substance that we use for insects and bugs and plants, guess what? It affects us the same way. So we know that there's a link there. So knowing that, okay, it's a disease state, we're not curing as much as we're trying to contain and slow the fuse down from burning, what do? I run a 24-hour UA on my patients, all of them. I want to know, what is the body holding on to and what is it throwing away? Because if I can see where the body is being stressed, I know how to nourish it. And if I can give it what it needs, it can put the brakes on this thing and slow it down. Now, once you do that, then any therapy you can do that helps the body with movement, that helps the body restore neurologic control and function becomes critical. So what are those? Chiropractic care, huge for this, absolutely huge for this. Physical therapy type things where you're moving parts and thinking about moving parts. Any kind of, the Chinese call it Daoyin. It's breathing with movement. Well, what is physical therapy? Breathing with movement, right? It's the same concept. Two different cultures saying the same thing. You have to keep parts moving. Small, intricate parts, big parts. And then you have to work on the connective tissue of the body and the pathways that are in it. Connective tissue pathways are like nerve pathways. It's how the body sends signals all over the place. You step on a tack, don't you know it, right? You step on, oh, that hurt. You know it immediately. So acupuncture that works in a similar fashion, and something called biodynamic resonance, which is a neurologic neurofeedback technique. They all focus on helping the body to relink pathways. It works extremely well in stroke, post-stroke victims to get them to walk and talk and move again. Well, guess what? It works in Parkinson's too. So nourish the body, give it what it needs, try to remove the stresses, use adjunct therapies to stimulate normal function and see if the body can slow down that fuse. And in some cases, if you expect a miracle, they might just happen. I'm Dr. Sean. I hope that helps you.